Daily rate of patients in the hospital for COVID-19 continues to increase in Massachusetts, even as the number of deaths from the virus remains low. Here to explain why is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. Dr. Raja, great to see you.
You too, Erica.
All right, Dr. Raja, we know case numbers have been rising. Same with COVID levels in wastewater. They had dipped a little bit. Now they're kind of climbing back up gradually. Do you think we're starting to see the impact of families traveling during April break now that most folks, I guess, have been back for about 10 days?
I think you hit the nail on the head, Ben. We're definitely seeing an uptick in the number of confirmed cases. And like you said, we're already seeing an uptick in the number of hospitalizations as well. But the slight rises that we're seeing, quite honestly, are nothing like the surges in the past. But there is an upswing. And like you said, that's what we'd expect a couple of weeks after school vacation week.
Well, as we mentioned, it is somewhat encouraging to see the death rate remain relatively flat. Do you expect that to continue, we hope?
I do, Erica. As long as the current BA2 subvariant of Omicron remains dominant, we've seen that this variant leads to milder infections than some of the other variants in the past. But just because it's leading to fatal infections doesn't mean it's not impacting people's lives. I'm sure you have this too. I have friends who are having to keep their kids home from school, friends who have to stay home from work to take care of those kids. So if you're feeling sick, please don't send your kid to school. Please don't go to work and get your coworkers sick. We still need to be careful.
All right, as you well know, Dr. Raja, the CDC now says nearly 60% of us were infected at least once with COVID by the end of February. That percentage is certainly a lot higher now. Do you think the virus might be running out of people to infect anytime soon?
That would be so great, Ben. But unfortunately, and I know you know this, that's just not the way it works. As you mentioned, back in February, I think the CDC said that 57% of Americans had some antibodies against COVID. The problem is those antibodies can last anywhere from a year or two after infection, and it doesn't say anything about how high the levels of the antibodies were. And so we've seen plenty of people, friends, colleagues, patients, who come in with reinfections, especially since the newer variants are more infectious than the earlier variants were.
Okay, so way back when, we used to talk about the goal of herd immunity. Is that even possible? I mean, basically, I'm hearing it's just not possible anymore.
Yeah, Erica, it probably isn't. Now, the thing is that we used to talk about herd immunity, but as we were just mentioning, these newer variants like BA2, they can evade the immune protection that people have built up from prior infections. And herd immunity usually relies on a virus that stays more stable than COVID has. Fortunately, though, we've got vaccines and we've got boosters, and that's where our best bet for immunity is going to come from.
All right, Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Massachusetts General Hospital. Dr. Raja, thanks very much for your time as always.
Thanks, Erica.
Thank you, Doctor.